Welcome back. You're with Weekend Dialogue. We have with us representatives of the Dr. Neville Fernando Teaching Hospital in Malabar joining us this evening to discuss about quality healthcare and of course the health service in Sri Lanka. We have with us Professor Anura Weerasinghe, who is a professor of medicine and immunology at the Dr. Neville Fernando Teaching Hospital of Saitam. Welcome to the show.
Welcome. Good evening.
Good evening to you, Professor. And of course, we also have with us Mr. Harsha Subhashana, who is the marketing manager of Dr. Neville Fernando Teaching Hospital, joining us this evening on Weekend Dialogue. Welcome to the show.
Thank you.
Well, I think we should start talking about the Dr. Neville Fernando Teaching Hospital. Of course, it has been established a few months back, but doing contributing at large to the health service in the country. Let me start talking to Mr. Harsha Subhashana. Tell us what this quality healthcare and affordable price is all about that you all talk about.
Yeah, that way I would like to start with what our hospital is and why it is different to the other hospitals. Our hospital is the largest private hospital in Sri Lanka so far built, with 1,002 beds. Plus, it's the first private teaching hospital in Sri Lanka. So that means the care of the private hospitals, plus being a teaching hospital, the superior quality service is also packaged or amalgamated in Dr. Neville Fernando Sri Lanka Russia Friendship Teaching Hospital.
And if I move on to talk to Professor Weerasinghe, how do you all ensure that quality health service is delivered through this hospital?
Actually, when you really think of the vision of our creator of this hospital, Dr. Neville Fernando, after his successful journey through Asa Central, he actually wanted to establish teaching in addition to healthcare.
Okay.
So when you teach the medical students as well as the nurses together with caring patient, obviously the quality improves, because medicine is a field which is evolving day by day and new things are coming up. And as a result, both the consultants on one side and on the other hand, the students and the other staff all are trying to do the best for the patient.
Right.
Because ultimately what we need at the end of the day, the person who come with an illness to cure them and or make them comfortable. Most of the time we can't cure.
Right.
Actually we make them comfortable, and so it's not just giving drugs, there are a lot more in it. So it's overall care is being taken up at this place, because we have got over 40 qualified consultants. In fact, I was in the national sector in California University. I ended up here because I thought I can render a better service in this manner, being a physician and an immunologist, well, which has a lot of research going on. So the research helps us to improve day by day. Obviously the quality improves in the management, and which is ultimately good for the patients, the country and the people at large.
Right. And I'd like to ask you, Mr. Subhashana, now you did mention that this is the largest private sector hospital in Sri Lanka with about 1,200 beds.
1,002.
Okay, 1,002. And how do you all ensure this affordable price aspect?
We give a consultant's appointment only at 150 rupees, which is probably 10 times higher in any other private hospital.
But how do you all do that?
Plus, I mean, let me give one or two other examples, and I'll tell you the reason why, you know, or the possibility how we give these services at such affordable prices.
Okay.
Another example is 1,500 rupees a cubicle bed with 3 meals plus the doctor and medical care as well per day. Is very, very affordable to the public, and in fact, if you take our cubicle beds care, we don't have professional charges in it. So for an example, if you take a typical private hospital bill, it will be about let's say if it's 100,000, minimum 50,000 or higher is professional charges. Now, we, in our case, since we have recruited, as Professor said, we have recruited consultants full-time, over 40 consultants full-time, there's no professional fee in our bills. So that's a huge advantage for the public. So it's at least 50% or even more lower than any other private hospital bill in our hospital. You asked a question that, how do we do that? How do we give all these benefits to the public? It's very simple. We have, thanks to our university or our SITEM, the medical faculty, we have a large number of students studying with us, and they pay a huge chunk of money for their education. So that benefit directly we are transferring to the patient, and so we don't have to burden the patient 100% for our survival, since they contribute to our bill.
Right. So, like you did mention that the training hospital, the teaching hospital itself benefits at large to the service that you provide to the hospital. Professor Weerasinghe, now, what is this? How does the idea of establishing a teaching hospital also come up with the hospital itself?
Actually, when it comes to medical teaching, well, it's the knowledge, skills, and attitudes. Those are the three important things a doctor should gather. So we get the knowledge through whatever the formal way, the skill which is caring patients, that of utmost important, and then of course the attitude. I think, well, we all know whenever we fall ill, I mean, all what we need is tender, loving care, not only the patient, the patients and the family, everybody. So here you get the it's atmosphere what you get at the family, and also the quality of care. Well, when you look at the quality of care, the most important thing when it comes to a disease, to make a precise diagnosis and then give the correct treatment. Say, if you think in terms of an infection, which we all of us get, and whenever we get an infection like fever, we have to first find out exactly what is the reason. For instance, what is the organism? So we straight away, like how it is done in all developed countries, we straight away go for investigations to identify the correct cause and then try and treat. So for that, we have got enough and more facilities and manpower. That's the important thing, because we work like a team. There we get the support from the microbiologist and all the other relevant specialities. As a result, we can give the best of care for the patient.
And your area, you're also a professor of immunology. There's a huge scope for this area in Sri Lanka, but there's lack of focus at the same time. If you could elaborate on that.
Definitely, the immunology is at infancy in Sri Lanka. In fact, as a result, we established the Allergy and Immunology Society in Sri Lanka to try and expand the speciality, and which is developing all over the world, but we are really at the infancy, as I told you, in Sri Lanka. So this is one place where we can really try and improve the quality of care in that field. For instance, when you think of immunology, one of the important areas is allergy. We all of us suffer runny nose, wheezing, hives, food allergy, you name it. I think all those people are going round and around, pillar to post, without trying to find out the allergen and trying to get the best of care. So this is one place where we can actually develop, because we have got the necessary infrastructure and the expertise, and we have got the international links, and we are also doing research in collaboration with the public sector as well.
Right. Now, with this research idea, Mr. Subhashana, what plans does the hospital have in future with the research, that the investments that you all make in research, which as a country we actually don't have a lot of research into investment into research and development, but this hospital itself has paid a lot of attention into research, investing into research. Where do you all look at going forward?
Yeah, talking about finding new knowledge. In other words, research is done to find new knowledge. Actually, that's part of our mission as well, to find new knowledge with special reference to the Sri Lankan context. There, I think the academia itself that we have is a huge asset that none of the other private organizations in Sri Lanka don't have right now. We have over 40 consultants working full time, and they devote themselves to not only to the clinical services of the hospital, but they are also putting their efforts of finding new knowledge, doing research, and contributing to the knowledge of the medical knowledge of Sri Lanka.
And hence would be able to deliver a superior health service to your clientele and of course the patients that visit the Dr. Neville Fernando Teaching Hospital. But what other areas, what other plans do you all have in future to deliver the best of service to your patients?
Mostly we have these consultants full time round the clock. If you take any other private hospital, mostly the consultant's care is there only for a few hours when the patient's consultant is available in the hospital, and mostly they are visiting consultants, so they're there during only their visiting hours. But in our case, since we have over 40 consultants full time, and they are rostered and they work round the clock for patients' care, so at any given time we have a consultant to look into patients' care. For an example, when you get admitted, obviously you get admitted not for common cold and cough, for something serious, and you would not know when and where you need consultant's care or your consultant's care. But if he is not there for you when you really need him or her, I think it's sometimes things can go wrong. But in our case, we have consultants full time, and it's a huge advantage. But not only that, I mean, in fact, I think Professor mentioned about the teamwork that we have. It's not only a particular consultant. Now, if it's only visiting consultants, probably the consultant is there during the visiting hours, but he doesn't have other required specialists coming at the same time to have some teamwork about a patient. What he can probably do is, in common, what happens is you refer to another colleague of yours on the PhD and you go, but that colleague comes at a different time and then look into the patient and make his comments. But in our case, it's not like that. The cardiologist, the surgeon, the physician, all of them are available at the same time, and they get together and make decisions from the patient's point of view collectively, and they discuss and make decisions. So that's also an advantage where patient's care is concerned.
Right, with all this that you all make available, it's still a question to me how you all keep costs down and of course make it so affordable to your patients. But I think it's a way forward. I think it's a new area that your hospital has ventured into in terms of private healthcare, ensuring affordability and also superiority in health service. If I finally move on to talk to Professor Weerasinghe, if we talk about the healthcare sector in Sri Lanka, the service itself, what areas do you think we need to improve on, apart from the challenges that we have overcome? I'm sure there are areas that we really need to work on, but what do you identify these as?
For instance, think of, say, renal kidney diseases, for instance. Kidney disease of unknown, uncertain origin or etiology. And those things we really can go in depth and investigate. In fact, one of the problems in the health sector is brain drain. Like doctors do leave the country. Why do they leave? Well, for several reasons. One of the reasons, they probably don't get the satisfaction here. So this is one place where really they can come and enjoy work, and in fact, which is already seen, some expatriate doctors are coming. In fact, as a result, the quality naturally improves, because it's not, we can't be like frog in the well attitude and close ourselves. We should be open to the rest of the world. In fact, our own people are coming back, and it's a stage for them to work. In fact, that's why I'm here. In fact, I'm with MD-MRCP, did a PhD, and well, I find this place is much more interesting. In fact, you know, our own place